kind of advice would you give other patients when they think about their journey and their bone health and whether they have low bone mass or osteoporosis? Do you have some advice that you might give people?
Well, I know it's not official and, standard procedure, but I so wish I had known what my baseline was before menopause. It would have just given me a better picture and more information, because I love information about what I really was to start with. Because if I had to guess, and I had this secondary issue, maybe my whole life, nobody knows, I could have really been low even then in terms of never reaching my peak bone mass. And what's interesting is that both my daughters have had because of me, have had their baseline done between 30 and 35. They're 41 now. And neither one of them reached peak bone density. Neither one of them for their age. So they will know where they began, and the numbers in the future for them will have a whole different meaning than mine did. Mine were just the figures at that point.
Right. I think that the bottom line, though, is that most guidelines based on data from really good studies would say that with the exception of certain circumstances, most premenopausal women and men don't get bone densities, because when you are younger, even if you do have osteoporosis, you really don't have as a higher risk of fracture. And that's the whole goal here, is to prevent fractures. So that is why most people would say for sure at 65 for women, 70 for men, but younger than 65 at or around the age of menopause, because we know that women can lose even up to 20% of their bone mass in the years before, during, and after that final menstrual period. Most women can come up with, and most health plans even will often cover a baseline at that point to know where you're beginning that process. So I think by convention, though, most do not get bone densities when they're premenopausal. And when you are premenopausal and you get one, we talk in terms of Z-scores, age-matched controls, rather than a T-score where somebody is comparing the peak bone mass with somebody who's around age 30. So,
unfortunately, nobody, the people they were working with understood why they were getting it, and nobody discussed putting them on medication, or, it was really something that they wanted to know. And because they had the risk factor of me, actually the insurance company did cover it. But I understand it is not the standard way of doing things. But I think it has just, put some information in their mind that would not have been there before.
Right, like making sure they keep their diet, filled with calcium products, and making sure they get enough vitamin D and exercise, strength. And for you, specifically as you get older, probably the most important factor, I say this to every patient, is, balance, fall prevention. And that's where I think most people need to focus their future aging. I always say, brush your teeth at night in front of the mirror. We have a counter in front of you on one leg, and see if you can do that to balance. So,
yeah, yes, and I do believe that they're at their age, when they were in their early 30s, I do believe that they got started on a whole program of calcium and vitamin D more than any of their peers. They would bring that up to me, that they were the only ones in their peer group who were focused on that at all. But just because of me and the information that I had passed on to them.
Isn't that wonderful?
Yeah.
Right. Any parting words you'd like to share with us?
Well, I just, I really think it's important for people to educate themselves, to really be able to advocate for their own health journey. I think it's really important. The more the individual patient knows, the more they will be able to have that conversation with their healthcare provider and be a part of the discussion about what's going on. And knowledge is just so powerful.
I agree. The buzzword in medicine now is shared decision making, which I think is really important. But you can't do that shared decision making unless you have the education. And we're all capable of understanding at every level what is happening. So